person this morning. Last week was a historic week for health, with 3 high-level meetings on health issues at the UN General Assembly in New York. Member states approved strong political declarations on pandemic prevention, preparedness and response, universal health coverage, and tuberculosis. All 3 are relevant to the work of this region, and all 3 depend on a strong WHO and a strong PAHO. I thank Jarbas for his report, which contains many reasons for celebration as well as reasons for concern. And I would like to use this opportunity to congratulate you, Jarbas, for your first anniversary, and all the best for your leadership in the next years. In particular, I welcome the reinvigoration of the Elimination Initiative, the launch of the One Health Action Plan, and the other work of the regional office. Over the past 6 years, WHO has undergone the most significant transformation in its history, grounded in a bold new strategy, the 13th General Program of Work. As you know, we are now working with member states to develop the 14th General Program of Work for 2025 to 2028. In my address to the Regional Committee last year, I outlined 5 priorities, the 5 Ps, which are now becoming the basis for GPW 14, to promote, provide, protect, power, and perform for health. A few words on each. The first priority is to promote health and prevent disease by addressing its root causes. Much of this work depends on individuals and communities being empowered to make healthier choices. So I welcome the proposal on strategic communications for behavior change, which you will consider this week during your session. Likewise, the policy on prevention and control of non-communicable diseases in children, adolescents, and young adults will be important for saving lives and saving health costs in the long term. And thank you, Jarbas, for taking this as one of your initiatives. In June, I was honored to attend the Ministerial Conference on NCDs and Mental Health in Barbados. The outcome of that conference, the Bridgetown Declaration, is a collective call on all countries to support small island states to address the impact of NCDs and the mental health alongside the existential threat of climate change. For the first time, this year's COP28 in the United Arab Emirates will include a day dedicated to health, and I encourage all member states to participate actively and hope to see you there. The second priority is to provide health by radically reorienting health systems towards primary health care at the foundation of universal health coverage. The most recent edition of the Global Monitoring Report on UHC, published last week, shows that as a region, the Americas enjoys one of the highest levels of service coverage in the world. Although, of course, there is wide variation between countries. I'm pleased to note that 34 countries in the region are implementing strategies and plan of action to increase response capacity at the first level of care. But the report also shows that there has been little change in 20 years in the percentage of the region's population who experience financial hardship from out-of-pocket health spending. So I urge all member states to focus on financial protection for your population, especially for women and children. Maternal and newborn, child and adolescent health are crucial. And I'm concerned to note that immunization coverage rates in the region have now hit a 10-year low following the COVID-19 pandemic. Restoring routine immunization to pre-pandemic levels is vital. To support member states, WHO has launched the Big Catch-Up with UNICEF and Gavi to support the most affected countries to catch up, recover, and strengthen their immunization infrastructure. That includes services for mental health conditions, which are a major cause of death and disability in the region. So I welcome the strategy for improving mental health and suicide prevention, which you will consider this week. I also commend to you the policy on strengthening human resources for health, because as you know, there is no health without health workers. I know from my conversations with many ministers from the Caribbean that they are frustrated at losing their health workers to international migration. Of course, we understand that migration will happen, but we urge all member states to honor the global code of practice on the international recruitment of health personnel. We also ask those member states who recruit from Caribbean countries to support Caribbean countries technically and financially to train more health workers. The third priority is to protect health by preparing countries to mitigate health risks and to rapidly detect and respond to both acute and protracted health emergencies. More than 360 million people worldwide are currently in need of humanitarian assistance. I'm especially concerned about the deteriorating situation in Haiti, where almost half the population is facing hunger. The cholera outbreak is continuing. There are alarming levels of gender-based violence. Attacks on healthcare are continuing, and 1/5 of the population lacks access to health services. The people of Haiti deserve better. We call for safe and unhindered humanitarian access. We call for attacks on health to stop. And we call on partners and donors to scale up support and not to forget Haiti. WHO PAHO's emergency appeal for Haiti is $36.6 million, targeting support for 18 million people. So far, we have received just $12 million. I hope you will continue to support. Meanwhile, regionally and globally, the same vulnerabilities that COVID-19 exposed persist. That's why WHO has developed a plan for a more equitable, inclusive, and coherent global architecture for health emergency preparedness and response with equity at its core. The new pandemic accord and amendments to the international health regulations will provide the vital legal foundations for this architecture. However, I'm concerned that negotiations are moving slowly and that the accord may not be agreed in time for next year's World Health Assembly. I urge all member states to work with a sense of urgency, with a particular focus on resolving the most difficult and contentious issues. This is a unique opportunity that we must not miss to put in place a comprehensive accord that addresses all of the lessons learned during the pandemic, with a particular emphasis on equity. This generational agreement can only be written by this generation because we are the lived community who knows how it feels, and we have the responsibility to write this accord and to ensure global solidarity to prevent any pandemics to this scale in the future. Promoting, providing, and protecting health are proposed as the 3 key priorities for all member states in the 14th General Program of Work. The other 2 P's, powering and performing for health, are enablers of the first 3. Powering health means harnessing the power of science, research and development, data and digital technologies. Just a few weeks ago, WHO launched the Global Initiative on Digital Health at the G20 Health Ministers meeting in India. The Global Initiative will support member states by converging and convening global standards, best practices, and resources for digital health transformation rooted in people-centered, evidence-based solutions. And the final P, performing for health, is about the work we're doing at the Secretariat to support you better. In particular, one of my key focuses for the remainder of my second term is to strengthen our country offices. with a core country presence, delegation of authority, adequate financial and human resources, the implementation of global mobility, enhanced internal communications, and more. And for our countries to be strong enough to support countries based on their priorities so we achieve the derailed SDGs. To support these efforts, I have squeezed $100 million from our budget to allocate to country offices. Our program budget for the next biennium is also the first in which country offices will be allocated more than half of the total budget for the biennium. We have already increased funding flows to regions and countries, and the more flexible funding we receive, the more we can increase that amount. Our work to strengthen country offices will benefit greatly from the 20% increase in assets contributions and by the proposal for an investment round, both of which you approved at this year's World Health Assembly. We're also continuing our efforts to strengthen our workforce, to achieve gender equity at all levels, and to make zero tolerance for all forms of sexual misconduct a reality and not merely a slogan. My thanks to you, my friend Jarbas, for your leadership and partnership, and I look forward to continuing to work with you in the coming years. Thank you all once again for your continued commitment to promoting, providing, protecting, powering, and performing for health in the Americas. I wish you all a very productive and successful regional conference, and I thank you. Obrigado, muchas gracias, and merci beaucoup. And back to you, Mr. President.